Hello. Thank you for joining Experian Health today as we present 4 strategies to better understand your members and streamline care coordination. Our goal is to give you a comprehensive look at the solutions that Experian Health has to offer to help health plans with data-driven technology. Our presenters today are Chris Wild, Vice President of Adjacent Markets, and Christian Brown, Senior Director at Experian Health. And now I will pass it off to Christian to get us started.
Hello, everybody. As Brad mentioned, we want to give you a view into Experian Health care coordination solutions today. Set the table. In our work with health plans, we tend to see some key things that can really make or break, an effective care coordination effort. This starts with first understanding and getting visibility into your members' activity. Know when they're seeking care in settings where care coordination becomes a needed exercise. From there, a lot of conversation, obviously, for the last few years around social determinants of health, but it's really important to start to have a conversation around how unknown barriers can really foil care plan follow through and how to gain insight into those SDOH barriers and then begin to mitigate them. The next is something that I think all health plans feel at some level in their day in, day out operations, which is just having inaccurate or insufficient contact information, demographic information on your members. Not having that information really reduces the efficacy of your outreach and engagement efforts, as well as create potential security risks. And then the last is having a convenient way to connect your members with the needed providers, needed services along that care journey. At each moment of influence, this becomes very, very critical because you have a window of opportunity and you want to be able to capitalize on that. Now, we just kind of raised a number of different places where your care coordination efforts can be foiled. You're probably thinking this requires a number of different solutions, and generally that is correct. That creates another problem, which is as you seek solutions to these issues, the options that you're looking for can be disparate. That creates disjointed solution platforms that don't integrate well with each other. You've got different looks and feels to these solutions, which can really create friction for your users. It takes longer to train. The usage of these can be more difficult because of the different looks, the different feels. And then you start to think about, the friction that can be created by having multiple vendors to manage, as well as the costs that can add up financially by buying all these solutions piecemeal versus at scale. With that said, Experian Health can help you solve for all these areas or one of them, or scale into these over time, by providing a suite of solutions that are best of breed, that are all within one platform, really providing you a very seamless way across the journey to solve for these individual issues. To begin, we're going to start by talking about notifications and understanding insight into your members' behavior. This slide here, probably nothing world-shattering in terms of what's on here. Challenges in understanding utilization patterns in real time, kind of falls into the categories of your typical things like ED overutilization. Where are your members, or who are your members that are seeking care in settings that, like an ED that aren't the most appropriate? How do you work to reduce unnecessary admissions and or readmissions? How do we make sure that your members are staying in network and not having encounters out of network? And then how do we take insight into your members' behaviors to better manage transitions of care once an event has occurred? And the way Experian Health helps organizations solve this problem is through what we call our member match solution. This solution is built off of Experian Health nationwide ADT network within facilities. Through that network, Experian Health receives real-time notifications when one of your members is seen in an ED, when they're admitted to an inpatient facility or discharged from an inpatient facility. So when that happens, we're able to, in real time, provide notifications to your organization. This could be your care managers, your high-risk engagement units. This could be primary care physicians. We've got a very robust rules engine and configuration settings that we can work collaboratively with you to build queues around certain membership segments, things like that, to route these notifications to the most appropriate team or person, so that by receiving those notifications in real time, you then begin to have the information you need to kick off the right set of care coordination activities. And we can deliver this to you, like I said, in a number of different ways. This could be batch files, XML integrations, SMS or email notifications. So we have a lot of different flexible ways to seamlessly integrate this into your workflows. So I've opened up with kind of our first chevron in the journey with the notifications. I'm going to turn it over to Chris Wild here, who's going to walk us through our SDOH insights and identity management pieces of this, and then I'll wrap it up with scheduling. So Chris, turn it over to you.
All right, thanks very much, Christian. So as Christian mentioned, I think, there's a lot of steps in the care coordination process and just kind of understanding who your members are. Once you get the notification, it's kind of the so what. I've got a notification, I have a indication that some event has occurred. So what? What do I do about that? And social determinants is one of those ways that we can provide a little bit of so what. Social determinants these days has almost become more of a cliche, and there's a lot of folks out there that are providing social determinant-like data, and a lot of it is based on things like surveys, which has a lot of issues with it, and there's a lot of caveats that need to be made when you receive data back on a survey, for example. So we have a lot of data that we've collected over the years. It actually comes from a whole host of sources here at Experian. And so we've looked at the social determinants of health as really kind of a whole category of solutions here at Experian Health. And so we're looking at things, what are those factors that are impacting a person's outcomes? And that could be things like access to transportation. That could be access to technology. It could be financial wherewithal. There's a whole host of things, and there's only a few of those that we can actually impact. So we've really chosen to focus very, very closely in on those. Keep in mind, all of this data that we've got is member level insights. This is not an aggregate score. This is not an estimated score. This is for that individual specifically. And we can provide this to you in a number of different ways. Very similarly, we have a batch that can occur, on a one-time basis, a quarterly basis, monthly basis, annual, et cetera. We can also provide this through an API and then kind of tying it to the member match solution. If you're doing the coordination of care, we can also surface this kind of data to you in a portal that way as well. So digging into it a little bit more and looking at what fuels the algorithm, there's a whole bunch of data that we have collected over the years. Being a credit reporting agency certainly helps with that, but there's a lot of information that we've got on businesses and community-specific information. So in general, we house about 1,500 discrete data elements on 300 million consumers. So basically, virtually the entire U.S. population. We also have a lot of community-specific data. So where are specific businesses? Maybe it's a physician's office. Maybe it's a post-acute care setting. Maybe it's a pharmacy, those sorts of things. And then we layer in some very specific algorithms and analytics, taking a look at that data. Taking one data element or data point on its own might not really have any real impact to somebody's outcome. But if you take things in combination, for instance, if you've got somebody's age, maybe they're 75 years old, taking that on its own and sort of in isolation really doesn't tell you much. But once you start to layer in some of the things, maybe this person is very active, maybe they're very health conscious, that might be a very different 75-year-old than somebody who is not so health conscious. cetera. So, looking at a lot of that other data really drives the outcomes for our algorithms. And I'll get into this in a little bit more detail here in a minute. And lastly here, I'll mention that we are what you call an original source compiler. And what that means is we buy some data from people, but we know where that data is coming from. We literally have line of sight to every single data element that we've got. And so as we drive to, compliance and things of that nature, we've got your back. We have the ability to audit all of the data that we've collected to make sure, A, that it's accurate. We've got a very incredibly robust process by which we ingest data. But then we also have an audit process over time to make sure that that data remains up to date, consistent, clean, and good. And then lastly, when it comes to the permissions, we have the permission to use that data in the ways that we are using it for social determinants. So digging into the actual solution itself, basically it's more than a score. And so if you look at a lot of what's out there today, you'll get a score. So you'll see somebody that has access to transportation, or maybe they'll have a social determinants of health score of 7, or maybe they'll have a risk score of 9, or maybe they'll have very specific scores based on things. We provide a score, but then we also provide the drivers to that score, because in our book, a 7 is not always a 7 is not always a 7. So if I have an access to care risk score of 7, it might be because they don't have access to transportation. It might be because they don't have, they're non-ambulatory. It could be because of a lot of different reasons. But what are the drivers of that score? And then ultimately what we're trying to do is provide data at the point of care, really to allow you to do some really good care coordination. And so helping your members improve is going to be critical when you're looking at non-clinical information. So do I dial up an Uber to get this person to their doctor's appointment? Do I set them up with mail order medications and things like that? Really depends on what those drivers are. So we provide the driver, but we also provide a recommended engagement strategy based on the drivers. So we try to boil it down for you so you don't have to do a whole lot of analysis. It's really designed to provide very quick access and quick information so people can make the right decisions in a very hectic environment. So as we look at this, I mentioned we can surface this kind of data in a number of different ways. So we have this is a sample notification in our care management tool. So this is member match that Christian just mentioned and was talking about a few moments ago. So we can provide this to you in that sort of scenario where it's, you have the ability to drive actions based on cues. You can drive those cues or build the cues based on risk scores. Maybe you can build it off of an engagement strategy, et cetera. And we can also provide this to you in an XML interface. We can provide it to you in regular alerts. We can provide it to you in a member encounter view, extract reports, you name it. We have a lot of different ways that we can provide this data to you. And the bottom line is that however it's best used in your environment and for your purposes, we have the ability to accommodate that. And then lastly, just to kind of wrap up the social determinants component, as I mentioned, we've identified a number of factors. Only a few of those are things that we can actually impact or address or have strategies to address. So we've really focused on the ones you can see here on the screen. Access to care, so that would be access to a physician's office, a care setting of some sort. Housing instability, does somebody have regular housing or are they more transient in nature? Food insecurity, are they living in a food desert? Do they have access to food? Do they have issues with food that we need to be able to address? Access to medication is another one. So obviously, if you can't take your medications, it's really tricky to manage the care over time. And then lastly, with all of these, we provide a technology adoption. So once we know how to interact with somebody and what sorts of things are affecting somebody outside of their clinical data, how do you interact with them on a technology front? Are they, would you send them a text message? Would they be better off getting a phone call? That sort of thing. And so being able to communicate and engage with people is really a big critical piece of pretty much everything that we do here at Experian. So moving on to the identity management component, there's a few things that we do here, and we look at identity management really in 3 veins. There's identity matching or identity validation, so making sure that this person is this person is this person. We also have identity verification, which is making sure that this person is who they say they are. And then we have identity enrichment, which sort of includes some of the social determinants that I just spoke about, but includes a lot more, much broader data set than that. Some of the challenges and some of the things that we've found from talking to our customers are that ability to contact people. member engagement has long been an issue and something that we've tried to tackle here in healthcare. And so being able to understand who that person is and be able to communicate with them is a real big challenge that we can solve. So we have information about their most current address. We have information about the most current phone number, et cetera. And so making sure that we have the right information, especially if you're coming from, a potentially dated database of sorts, trying to update that information is really helpful. And then ultimately, we're finding that some of the challenges that we can help address is that data coming from multiple disparate data sources. You've got lots of different sources for data. It might be a claims data from a hospital system. It might be a database coming in from CMS. It might be a database coming in from an employer. All of these things have different formats and different default values and typos, as you can see, and a lot of folks that enter this kind of data aren't always as clean as they probably should be. And so trying to have some of that data quality and updating where we can really helps. And then one of the last challenges that we help solve is that lack of enough matching data points. If you have a first name and a last name and a date of birth, that's probably not enough to make a match. But if you can start to layer in some additional data, as I'll describe here in a few minutes, that really becomes critical in helping that matching process. So kind of drawing that out, if we use Maria Lisa Lopez as a good example. So in this case, Maria Lisa Lopez, born in 1980 in Houston, Texas. At the tender age of 9, she's diagnosed with diabetes. So this is really good for us to know. As a health plan, we want to understand who our patients are. We want to understand how we need to address our patients. Obviously, we want to put her on some sort of a care plan so we can minimize the long-term costs and hopefully improve her long-term health. In 2001, Maria Lisa Lopez moves to San Diego. She gets married in 2009 and becomes Maria Lisa Garcia. Her and her new spouse have a few children and decide to move back to Houston to be closer to her family in 2014, where she ends back up at the same hospital, very close to family, so that they can take care of the kids while the two of them are off to work. And as they're going to their hospital, that she's now going back and being seen as a diabetic patient. But this hospital might not notice that this is the same person. This is somebody who's been away from the system for a while, completely different last name, completely different address. And there's none of that sort of connective material to kind of tie these two, Maria Lisa Lopez from 1989 to Maria Lisa Garcia in 2015 together. So looking at how reference data is the key to matching, this is one of our biggest pillars if we look at how we look at identity. And so if you look at kind of using the Maria Lisa Lopez example that we've got, if you've got maybe your member file on the right-hand side is Maria Garcia, you get a physician office notification for a glucose test for Maria Lisa Lopez. We've got the same first name, we've got the same gender, we've got the same date of birth. They both live in Houston, Texas. Looking at this information, am I going to make decisions or am I going to drive care based on these two things? Am I going to merge this information together? And the chances are pretty slim. I probably would not recommend it. Same first name, same gender, same date of birth, living in the same arguably very populous city, certainly not enough for me to make a hard call and say, yes, this is definitely the same person. But once we start to layer in some of the other data, as you can see here on the next slide, once you start to layer in some of the additional data that we have in our data stores, you can start to see some of the connective tissue I was just describing. So we house a number of different aliases. So we'll look at people's last names. Maybe it's their married name. Maybe it's a name after they are divorced. Maybe it's a name that they go by, things of that nature. We store a lot of that information. We've got historic addresses. We keep about 25 historic addresses. So it's not time-based. It's basically 25 addresses. So you start to look at the additional information we have on each of these individuals. And obviously, we're a global company. So it doesn't matter if they lived in San Diego or Houston, Texas, we've got information on this individual. So starting to tie this all together, and you can probably see where I'm going with all of this. Maria Lisa Lopez on the left from the physician's office, also known as Maria Lopez, also known as Maria Garcia. We still have the same gender. We have this a social security number, which typically is almost unheard of these days, but we happen to have one. We do have a phone number, which we are able to provide. And notice it is different from what we have in our member file, so we're able to update that piece of information as well. And then we've got historic addresses. And if you start to look through the historic addresses, we see a match with the payer member file on the right-hand side, 456 Tree Street in Houston, Texas. We start to see that, oh, wow, we've got the same address, we've got the same first name. We see these other names. The aliases are starting to match up. This is really starting to make it look like this is certainly the same person. And so I'm feeling more confident about making the match. And then if you look at the box in the middle, it really identifies what we are looking at and what we can see in the algorithm to make that hard call. So if you look at it's kind of a turnkey identity management solution. So we've got our match algorithm, which is based loosely off of our credit side of our business. So if you look at the Experian Health credit business, obviously we've been doing this for quite some time. So we have a match algorithm. Arguably the financial and credit algorithm leverages a social security number, whereas here in healthcare, it's not a very common data point. So we've downplayed the requirement for social security number and adjusted for other information that we might be able to gather from health information systems, from payers, et cetera. I mentioned we're also using our reference data, so we have 99.9% accuracy. I talked about this a bit ago. We've got an incredibly robust system. It's a very, very stringent requirement for us to ingest data. We don't just take data from, for example, you as our customer and ingest that into our databases. We would have to really vet where that data source is coming from, what the data is all about, how often it's cleaned, how it's verified on your end, and all those sorts of things before we can even consider ingestion. And then lastly, I mentioned the sort of simple integration that we can provide. So we have an API process, we have a batch process. Again, if there's a specific way that you want to ingest this kind of data, we can certainly do it for you. So I mentioned also about knowing your members and really engaging, and member engagement and patient engagement here in healthcare has been a humongous issue for us to overcome. And I think this is one of the areas that we've really found a lot of value in what we bring. So if you think about some of the things that we have, we've got a lot of data that we're collecting as a credit reporting agency. So that improves your demographics, that improves information about who that person is, where they live, as I mentioned earlier, their phone number, maybe an email address. And so we try to combine that with your own data to drive member engagement. If we can talk to people in the way that they're used to being talked to, if we understand how they think and how they want to make decisions and how they want to be talked to, it really makes a lot of sense. I'll give you a quick example. I'm an older parent. So at my age, I may not look it, but at my age, a lot of people are thinking about, are talking to me about things like retirement. Well, I've got a 7-year-old son, so I'm not thinking about retirement. I'm thinking about how I'm going to pay for college, and so I'm saving for college. So the right way to talk to me is more in terms of a younger parent, even though I'm an older chronologically person. So we're looking at how we can better address people specific to who that person is. And then lastly, we'll talk as we kind of go into the next slide here on identity verification. So identity verification is a huge part of our business, and obviously getting bigger now that we've got more drive towards remote access, especially under COVID. People aren't seeing people in person, and so we're driving a lot of video visits, a lot of online interactions, a lot of no touch solutions. So understanding who that person is and making sure that we know who that is before we divulge any sensitive information is becoming really, really critical. So digging into the next slide here, you can see that we've also provided a lot of help around identifying people and that risk scores. So if we look at a member inquiry, and this could be through any number of processes, it could be portal access, it could be through any sort of interaction you can think of. We validate the demographic data. Is this person providing us with accurate demographic data? So Chris Wild at 123 Main Street, is this the right person? Is this an address that's associated with that person? We also look at application data and things that are sort of related to that person. So we look at the device itself. Is this device associated with Chris Wild? Is this a device that we've seen before? We're making sure that we can validate the device itself is not being used for nefarious purposes. Have we seen it acting naughty? Have we seen it acting nice? Is it related to this individual? Is it related to this individual's family? So, my wife and I both have, I have an Android, my wife has an iPhone. It's very common for me to use her iPhone, so that device would be associated with me even though it is not owned by me. And then lastly, we have a really interesting spin that we can add to the fraud prevention. When an identity is stolen, as a credit reporting agency, we see credit activity, we see financial activity. And so after the shopping on the dark web, we can see a lot of activity around an identity in a short period of time. We call this velocity. Really interesting. If you see a lot of activity, new credit cards, new portal access attempts, et cetera, in a short period of time, there's a much higher chance or higher likelihood that individual's identity has been compromised. And so we watch that and factor that in. So if you layer all of these pieces of information into a robust strategy, we can build a robust decisioning strategy. So is this or is this not? Chris Wild using fraud risk scores. So we're looking at all of the information there on the left-hand side and then some, and we input that into the strategy decision engine to decide whether or not ultimately is this the right person. And then once we have that decision, yes, this is Chris Wild, or no, it's not, then what do we do? What's our next best action? Do we provide additional screening? Do we have them call a customer service rep, et cetera? So we help you with all of those areas. And with that wraps up our identity management portion. And as Christian mentioned earlier, that'll take us to the last component here is the scheduling piece. So Christian, I'll let you take it away.
Thanks, Chris. So, at this point, we've talked about, understanding, when your members are in, EDs, inpatient settings, things like that. You've got insight into their activities and their behaviors. We talked about, uncovering and mitigating potential SDOH barriers. Chris just outlined for us, some of the challenges with identities and how that can foil a care coordination plan. So the last piece of this is, scheduling, knowing all the things that we know now, how do we, conveniently and efficiently connect your members with, the right provider, the needed services, whatever it may be. And we approach this in two ways. One is our automated outreach self-scheduling capabilities. This can be used to put the power in the member's hands to coordinate that next part of the care journey. It can be used for lower acuity, maybe non-chronic, lower risk situations where, that next step is, clearly known. We can also give your teams the ability to digitally schedule appointments at moments of influence with your members. These may be scenarios that are needing a higher touch. Maybe it's a non-event driven situation where, a member and one of your teammates are, having an interaction and a need is uncovered at that point in time. So as we look at these in a little bit more detail, first going to start with, our self-scheduling outreach capabilities. This can be used really in kind of two scenarios mainly that we see typically. The first is, I mentioned, kind of an event-driven situation where, member is, let's say, discharged from an inpatient stay and a follow-up with a primary care physician is needed. We can tie this automatically to our member match solution to generate that automated outreach to the member. We can also put together custom campaigns based off of whatever your particular objectives may be. A lot of times we work with health plans to do this around care gaps. So you've got a subset of your members that are non-compliant within a specific care gap. We can build a campaign to automatically engage them. And we do this through SMS and IVR capabilities. A lot of vendors out there have been doing engagement or outreach to members via these channels for some time. Where we've really taken it a further step is embedding the ability to schedule that service within those interactions, enabling a guided search and scheduling experience that can be scheduled, with a few taps or a few clicks. Hitting on our call center scenario, which I opened up with, this is, again, a situation where one of your team members could be a care manager, could be a member outreach agent, a manager of, your chronic high-risk members, would be given the ability through our platform to digitally schedule an appointment while having an interaction with the member. Our decision support capabilities enable accurate scheduling, for all specialties, all service types. Really helps us accommodate scheduling to more complex provider types or situations. The guided search user experience, really ensures that that agent or that team member of yours is going to be guided to the right provider or the right service in less time with a lot less training. And then, the fact that this is a digital tool, eliminates the need for time-consuming three-way phone calls. More importantly, allows your staff to schedule appointments for your members 24/7, 365. We're not beholden to doctor's office hours. So you're going to get a much faster, much more efficient scheduling experience that can be used, any time of day or night. You're going to get more bookings because of that. It really untethers the scheduling experience from some of the limitations that are, inherent when you don't have digital access. So, the benefits that are going to drive one, I kind of hit on these a little bit along the way, but want to tie this up, is you're going to save time when scheduling needed care, improve convenience with self-scheduling options. This is the way the world is going today. You can schedule virtually anything with a few taps or a few clicks. Really great member experience to give them the ability to schedule that care, or when they're talking to one of your staff members, do that very quickly as well. All of this convenience and efficiency is going to drive better outcomes and help ultimately improve quality score, financial, things like that. So to tie all this up, we have kind of walked you through in a very short amount of time, a lot of material, but this slide really, brings it home in terms of how Experian Health can provide actionable intelligence and tools across, a number of different areas for your entire health plan, in terms of targeting and understanding preferences. How do we, better help you reach and manage the identities of your members, help you, coordinate care, better help your members access care while managing, the identity and security piece along the way. So appreciate everybody's time today. Thank you for your attention, and hope you found this beneficial and helpful.
Thank you, Christian and Chris. That was a wonderful presentation. And thank you all for watching today. We hope this information was helpful and valuable to you. If you have any questions or would like to know more, please contact our speakers at their emails, christian.brown@experian.com or chris.wild@experian.com. Thanks again and have a great day.